In the relationship between government-approved standardized medicine and all the other healing arts, we can see a pattern that goes back all the way. In, I think, about 1540, Parliament passed a law, the first Medical Licensing Act. It said nobody may practice medicine within the City of London unless they are first examined and approved by the College of Physicians and Surgeons under the Bishop of London. And of course, once that law was passed, the College of Physicians and Surgeons immediately started harassing all the other healers in the community. Within a couple of years, Parliament had such an outcry raised that a new law was passed, what is now called the Herbalist's Charter. It was 1546. It was in the 35th year of the reign of Henry VIII. And that charter, which was intended and stated it was a charter for all times, and it applied not just to the realm of England, but to the king's other colonies. And hence, of course, that means to the American colonies. And those American colonies, when they became free and independent states, adopted the common law of England as our common law. All the common law of that time is part of our common law unless the legislature explicitly changes it. And so the Herbalist Charter, which reviews the history of the relationship between the physicians and the wise women and the herbalists and the others of its time that we would call alternative practitioners, or as I like to say, advanced healthcare practitioners. Healers understand the charter and understand that it's part of a very long tradition of healing within the community. And that tradition is one which we applaud and which we are humbled by.
About 100 years ago, things were really beginning to change in the United States. We were changing from an agrarian economy to an industrial economy. Titans of industry really wanted to be able to control the world financial system as a whole. When the Rockefellers took over the allopathic medicine, there were many types of medical education in the United States. There were homeopathic doctors and there were naturopathic doctors who were using natural medicines to heal, and they were having very good outcomes. Once the Rockefellers took over the system, they closed down those other schools and they only promoted the sale of their drugs, they promoted surgery, and they promoted radiation. The Rockefellers were also in charge of the oil industry and the chemical industry, and they also made an alliance with a huge German concern called IG Farben, which was a big chemical industry in Germany. The Food and Drug Administration was started in the 1930s, and it was sold to the people of the United States as an agency that was going to protect its food and drug supply. And of course, in the early part of the century, people wrote about some of the terrible things that were happening with the meatpacking industry and in the food industry in general.
Patented drugs were being advertised all over. And then there were, nostrums were considered secret formulas. And there usually were proprietary formulas. So they got all these addictive drugs in there. And they weren't even listing them on the label. So people were thinking heroin and cocaine, morphine and other types of opiates. And they weren't being told that they're even on the label. So they forced a labeling.
There was a lot of mischief going on in the food industry, and the FDA was set up to correct that problem. They evolved into regulating drugs, medical devices, and at this point they regulate just about anything that goes into the human body.
In the 1930s, 1938, the FDA became a monster. And from that point forward, it has grown by leaps and bounds until the 60s, when it acquired jurisdiction over both safety and efficacy of drugs.
Then in 1938, they passed a law under Franklin Roosevelt defining a new drug, safe and effective for prevention, treatment, mitigation of disease, whatever. The FDA basically appointed itself as the experts. Senator Estes Kefauver sponsored an amendment that was passed, expanding the authority of the FDA to go beyond the safety of new drugs to the effectiveness of new drugs. And that was signed into law on October 10, 1962 by John Kennedy.
At that point, the FDA was largely captive of industry. The FDA does no clinical testing of drugs itself. It relies entirely on submissions made to it by the drug companies. This would appear to the average person to be a gross conflict of interest, and in fact it is.
There's a concern right now that the FDA has been influenced by Big Pharma in such a way that they're going to remove from the marketplace all of the new dietary ingredients that were introduced after October 15th, 1994. And regrettably, those are some of the most effective supplements that Americans are now taking. We're talking about resveratrol. We're talking about the ubiquinol form of coenzyme Q10. There have been substantial improvements made in the quality of dietary supplements. Drug companies are seeing this. They're seeing their profit margins threatened because people can go and use a dietary supplement in lieu of a prescription drug and perhaps get a better benefit with no risk of side effects.
Recently, the FDA promulgated a thing called the New Dietary Ingredient Guidance. In the first decade of application of the New Dietary Ingredient Guidance, FDA took a rather conservative view of what a new dietary ingredient was. They would say, oh, well, if it was in the food supply and you can show that it's in the food supply, we will allow you to sell it and not prohibit you from selling it and not require you to make a scientific submission. Well, increasingly in the 90s, the FDA took a more restrictive approach, increasingly requiring the submission of new dietary ingredient petitions before it would allow a substance in the market, and expanding its definition of a new dietary ingredient, keeping more things out of the market as a consequence.
The purported purpose for the guidance is to help create more safety for consumers out there that are consuming dietary supplements. The interesting thing to note is that there have been 0 deaths from dietary supplements as long as the CDC has been keeping track. Supplements are very safe. They're based on food. Congress recognized the safety of supplements when they grandfathered all the supplements to date. In 1994, when they passed the Dietary Supplement Health and Education Act legislation that governs the regulation of supplements. Now, Congress did at that time say any new supplements that were to come into the marketplace would be required to notify FDA so that FDA could keep track of what was happening going forward.
Well, 90% of the dietary supplement companies that now exist did not exist in 1994. And those that did exist, hardly any have records from 1994. Well, what the government is saying is, catch-22. Your product is grandfathered, but only if you can prove it. And it being on our published list isn't proof anymore. That's the sort of manipulation that we see coming out of the FDA. If the individuals working for the FDA were taking their job seriously, they would not do that.
The FDA has issued a guidance that not only requires notification, it goes above and beyond by requiring basically a pre-approval system and puts in place something akin to a food additive program that requires such enormous barriers to entry, so to speak, that it will eventually, according to our analysis by law and economics professor Joanna Shepard-Bailey at Emory, it will result in a loss of almost 30,000 supplements to the American public.
It would cost somewhere between $150,000 to 1.2 or 3 million per NDI submission. They've also said that an approval of an NDI, new dietary ingredient, for one company would not be transferable to any other company, even if it made the same product. As a consequence, they require every company that sells the very same product to submit a new dietary ingredient petition.
So there are going to be literally blizzards, truckloads, train carloads of paper that manufacturers are going to be forced to file, they can't do it electronically, with FDA. Oh, and by the way, just because they file it, do they get to use it? No. This idea of notifying FDA has been perverted into an approval process.
And they did all this on purpose. It ain't making the product safer, they were safe to begin with. All they did is, it's just pure harassment, economic harassment against the dietary supplement industry. The only purpose of that is to try to push them out of business, just to make room for a total monopoly of patented drugs.
The American public will be at the total mercy of the pharmaceutical industry. If they want a drug that will inhibit certain cancer processes like curcumin does, they'll have to rely unfortunately, not on a natural, low-cost, safe compound like curcumin. They'll have to go with an expensive pharmaceutical.
Ingredients that we've used to manage our health, from foods to functional foods to concentrated nutrients that are sold in dietary supplements, or as we call them in Europe, food supplements, are now being given this requirement to prove safety before they can be used. And what is so interesting is that this is right at the heart of the NDI draft guidance itself, that the FDA is now trying to push through.
Congress passed the Dietary Supplement Health and Education Act. Now, that legislation basically stated that dietary supplements were to be treated as food and not drugs. And FDA was directed to create some guidelines around that new dietary ingredient notification process. But FDA sat on their heels and waited. It's been 17 years. And FDA is just now coming out with this draft guidance. And FDA has gone very far above and beyond congressional intent in the draft guidance.
The agency has had a long-term bias that was identified by Congress in the DSHEA legislative history, and there was quite a bit of congressional testimony about the bias. And the whole aim of the agency has been to restrict the access of consumers to those products and to limit what can be said about them.
The FDA tried to circumvent it. They didn't like the idea that supplement companies were now able to inform the public about peer-reviewed research documenting safety and efficacy of nutritional supplements.
So you see, this rule is calculated by the agency to have a devastating effect, to be another weapon in their arsenal to take down the dietary supplement industry. It is cleverly masked with a public safety rationale. In point of fact, the rule doesn't operate to protect public safety.
So you've got 3 times as much regulations for dietary supplements as you have for pharmaceutical drugs.
Senators Hatch and Harkin both explained to the FDA that this guidance goes well above and beyond congressional intent. It creates a pre-approval system that Congress did not intend, and they asked FDA to halt the process, sit down with interested parties to discuss all of our concerns. The FDA denied that request. They declined to cooperate.
Now, the consumers have been made aware of this, at least the vitamin consumers who are significant. They are contacting Congress, they're protesting this. There's a chance that the FDA will not succeed.
It's an interesting approach that the FDA used, creating a guidance instead of a rule, because it doesn't provide standing for any of us to pursue legal proceedings against the FDA. It's, I think, a very strong strategic play on their part. They're trying to keep this out of the courts because in many of the situations and sections of the guidance, they just don't have a leg to stand on.
Now, a few years ago, FDA inspectors, they went around and they told everybody, you got to call all these products dietary supplements. It gives FDA jurisdiction to impose its dietary supplement good manufacturing practices on the manufacturer of that product. There's one thing that people don't know if you read the Dietary Supplement Health Education Act, is that a dietary supplement doesn't fall under that act unless you label it as a dietary supplement. Whereas you had the option of not putting that on there and leaving it under the food GMP, which is very easy to follow because it's been in effect for over half a century and it's a no-brainer.
Why should we be required to go through an additional major hurdle when in fact the Dietary Supplement Health and Education Act, for which millions of American consumers fought so hard to get, basically doesn't require an additional regulatory burden for those products that are already safe and effective?
Fear that the dietary supplement industry has is that if the FDA is given the power to restrict Americans' access to natural new ingredients. These are ingredients that people are ingesting as part of their diet for the most part. And then when a company extracts that and puts it into a capsule or a powder, the FDA wants to come in and say, well, now you've got to prove to us that that's safe and effective, even though there's no evidence that it's not safe and effective. The fear is that the FDA will try to do an end run around all the legal and political victories that have been won over the last 20 years and be able to restrict Americans from having free access to dietary supplements, to nutritional powders, to natural approaches to preventing and treating disease that compete against pharmaceutical interests.